just a few words about the project. The project is named DICES. DICES is about social economy, care, and organizational democracy in the global South Africa. This is the webinar. The DICES project is a European project funded by the European Commission, and through comparative research, local case studies, and policy recommendation, the idea is to have an analysis on how social economy organization contribute to welfare, governance, social inclusions, and working conditions across different European regions. Findings will be shared and are shared through publications, webinar, policy toolbox, and creating opportunities for exchange between researcher, professionals, and policymakers. Today, as part of this research and learning and mutual learning journey, we took this opportunity to have a glimpse and to exchange and have some more knowledge, not only from within Europe, but from outside Europe. And it's a Global South today, and with a focus on Africa. Why? Why? Because, and we were among the partners who also were supporting this when we drafted the proposal, because social economy, or as it's called at the international level, social and solidarity economy, has become a global fact, and it's a global business model, and there are a lot of similarities and a lot of knowledge that is spread all over the world. And we are really convinced that creating this bridge of knowledge exchange with the other continent will also be very helpful for European researchers to have this bilateral share, and we hope also to have this knowledge mutual exchange with Africa and not only. But I will not take much more of the time on this, because dear participants, you will learn and you will listen from, and this is the order that we've chosen. First, we have Mr. Ryan Dudai from the ILO, the International Labour Organization, where he is a technical specialist, and he will provide us with an overview of what the ILO and ILO COP, so focusing on cooperatives, and the importance of the care sector, and the care sector is one of the main target for DICES project, their perspective and the benefit of having social and solidarity economy in the care sector. But then I will give him the floor. After him, we will have Dr. Rose Karimi, who is a regional director of the International Cooperative Alliance Africa region. Welcome, Rose. And so we will start with a more, I'll say, a broad perspective. We will focus directly on Africa, about in the cooperatives and the care sector. And last but not least, Madame Polinefa, which from Cameroon, but not only, because she is representing here a very important NGO from Cameroon, PFAC, but she is also vice president of a global forum for social and solidarity economy, and she is a very important person for the present and the future of social economy in Africa and beyond. But you will learn more, because she will tell us, present us the relais model, a very concrete example. Now we are really going to the ground with the early intervention. A fantastic, amazing experience that has started from Cameroon and will be spread and is spreading also across Africa. So let's take from here. Ryan, the floor is yours.
Thank you. Thank you, Luca. Thank you for having me in this webinar. So my name is Ryan Kudai. I am from the ILO, and I work on cooperatives and social and solidarity economy at the global level. I am based in headquarters in Geneva, and as you may know, we have a dedicated team basically who works on promoting cooperatives and the social and solidarity economy in all the basically around the globe. We have offices in 187 countries. So, I mean, I'm not going to present the ILO, but I hope I can make the case. Today, I'm going to talk about our work, basically on the promotion of care and the provision of care through cooperatives and the wider social and solidarity economy from a global South perspective. Let me share my screen. Okay. I hope you can see my screen. Okay. So let me just start with setting the scene a little bit. This is all based on ILO research and basically policy work. So as you know, there's a big demand for care and it is rising. I'm just showing some numbers from the ILO perspective. In 2015, there were around 2.1 billion people who required care, and this number is expected to increase to 2.3 billion by 2030. And this is mainly driven by the rising numbers of children and older people. As you know, also, women are those who mostly carry the burden of care. In 2023, there were around 748 million people outside the labor force due to care responsibilities, and 95% of this number are women. On the demand side, we have more and more people who require care. And on the supply side, women who are the main providers of care carry this responsibility and are forced outside the labor force. At the same time, if we look at care work, we as ILO look at as the custodian of decent work promotion. We look at the working conditions around care, and for paid and unpaid care work, we see that the working conditions are really weak. So because of the informality and the informal nature of care work is undervalued and characterized by low wages, long hours, and exposure to occupational risks like violence and harassment. And again, women are those who are the most exposed to these weak working conditions, and they make up 65% of the global paid care workforce. According to a recent ILO report, investing in a comprehensive package of care policies and services could generate up to 299 million jobs by 2035. So there is definitely an opportunity to improve basically the working conditions around care and to increase women's labor force participation in that sector. So why does this matter in the Global South? First of all, if we look at the Global South, generally there are structural gaps, meaning that the public care systems are either weak or very limited, and governments are not, dedicating significant investments in infrastructure related to care services. This is one. Two, the high rates of informality, which is a feature of a lot of global South country, targeting a lot of sectors beyond the care sector. So care work is largely informal with limited social protection, access to decent work, and so on. The third point is that gender inequality. As I said, women carry the bulk of unpaid care, and its care is limiting their participation in the labor force. So these are the kind of the rationale or the reasons behind why there is need to invest in care systems at the policy level, at the institutional level, at the services level. And there are different ways to do that. There are different ways to basically imagine care provision. What is strong in the global South? This is, of course, a generalization, but it is a trend, I would say, is that in global South countries, there are strong traditions of solidarity and collective action, which brings me to, of course, being the ILO co-op unit, we are trying to make the case for care provision through cooperatives and the wider social and solidarity economy, but not for the sake of it, but because there are reasons for it, and there is complementarity to public care systems and private care systems. So moving on, this transitions into the SSE, the social and solidarity economy, as a people-centered approach to care. So as you may know, we are the only UN agency, united agency, with a clear mandate on the promotion of decent work through the social and solidarity economy. And we, as a normative institution, we have standards, we have international instruments around cooperative and the social and solidarity economy. And in our ILO resolution on decent work and the social and solidarity economy, which was adopted by our member states and social partners in 2022, we provide basically an international definition of the social and solidarity economy, which is basically, it is the economy that is characterized by all the enterprises and the organizations basically who have economic, social, and environmental activities, and which are based on a set of principles and values. And I have listed the highlighted, the most important principles here. So these, of course, you are familiar with voluntary cooperation, democratic and participatory governance, mutual aid, autonomy and independence, and the primacy of people and social purpose over capital. So organizations which are basically compliant with these principles are more or less, depending on the legal frameworks in the countries, part of the social and solidarity economy, and they're considered SSC entities. A few examples that we give in our resolution are cooperatives, associations, mutual societies, foundations, social enterprises, and self-help groups. And as I said, other entities that are operating in accordance with the values and the principles of the SSC. So, as I said, our work is generally anchored in our instruments, in our norms, basically. So we have two basically resolutions, one on decent work and the SSC, which I just mentioned, which calls for inclusive, integrated, and gender-responsive approach to promoting the SSC, particularly for groups in vulnerable situations, while recognizing the value of care and unpaid work. More recently, the ILO adopted a resolution on decent work and the care economy in 2024, which basically recognizes the role of cooperatives and other SSC entities in the provision of quality care, investment in sustainable and modern care infrastructure, and provision of training and employment opportunities. This is just to show you that there is a global, basically, recognition of the SSC and care, and the two resolutions basically recognize both care and SSC and the interconnectedness between both dimensions. And everything we do is anchored in these two resolutions. Sorry, just my screen blocked. Okay. So why are we basically talking about the provision of care through the SSC? And I took the examples of cooperatives because this is historically, at least in the ILO, this is what we've been working on the most, and it is the most predominant model of the social and solidarity economy. So how do cooperatives basically allow achieving decent work in the care economy? So basically, there are three main qualities. The first one is, of course, cooperatives provide community-based care, which is one locally tailored and provides bottom-up solutions because of the nature of cooperative, the participatory nature of cooperatives, which is grounded in communities and reflects the community needs and responds to community needs. It can provide basically community-based care services. Two, it has a participatory and inclusive decision making. So members of cooperatives are here in that instance care workers. So they basically identify their own needs and the needs of the beneficiaries they serve, and they're able to jointly make a decision based on those needs. So in a cooperative, care workers are basically part of a cooperative to serve their own needs and the community needs. And then interdependence versus dependence. This means that cooperatives are independent models that are sustainable and that do not depend on any external party for their technical or financial sustainability, and therefore they're able to provide care services in a sustainable way. The second feature is quality and affordability. Um, I mean, this is what I wrote here is a bit of maybe a generalization. It probably doesn't apply to all, but this is to all countries. But this is just to show you the comparability, basically, between cooperatives and other models. Compared to the private sector, cooperatives can achieve economies of scale and in most cases can provide services at a lower cost compared to the private sector. In public sector, due to the weaknesses of the services provided and the capacities and the infrastructure, they are in cases better quality compared to the public sector. And compared to the non-profit sector, which is highly dependent on donors and external funding, they are more sustainable because they are meant to be sustainable enterprises as cooperatives. And then the last point is decent work outcomes. Cooperatives allow care workers to have a stronger bargaining power. This is one of the feature of cooperatives. Better wages and working conditions, which is also linked to the negotiation basically and the advocacy that cooperatives make at higher levels, basically through federations, confederations, in participation in policy making decision. They allow for formal employment and protection. In some countries, care workers are not covered by the labor law, are not officially recognized, but by coming together and registering as a formal cooperative, they have access to formal employment and therefore for social protection. And then the professionalization of care work. This is where the feature of education and training of cooperatives come in handy. So this is just basically a slide to kind of make the case of cooperatives to provide care services, and a bit of a comparison with the public sector and the private sector. And of course, I mean, the point is not to say, let's just provide care through the SSC and only through the SSC, but it is a complementary way of providing care whenever the public sector, whenever there are gaps in public sector provision, and whenever the affordability is not there in the private sector. So this is to show you a little bit on the modality of provision of care through cooperatives. So if you look maybe at the right part of the slides, there are basically two ways of providing care as a side service to members, beneficiaries, and clients. So basically, established cooperatives who are education cooperatives or financial or agriculture or housing, which basically decide to add on a service related to care for their members. I could give an example of women working in agriculture who have, childcare responsibilities, who decide to basically come together and establish a child care facility at the workplace run by the agricultural cooperative to take care of their children while they are working. Another type of organizations is not through cooperatives, but through trade unions or local governments who basically come together and provide care through a cooperative model. And I will talk about this in an example in a few minutes. And then the third way of providing care through cooperatives is basically having a care cooperative, a dedicated cooperative for care services. There are a few examples in this slide related to domestic worker cooperative, daycare cooperative, elderly care cooperatives, and so on. So these are the different modalities of providing care through cooperatives. So this is all a little bit, I would say, evidence-based kind of theoretical work that the ILO has done based on publications, on research, and so that's one part of the work we do. And then another part is more the practice. So how do we put this into practice? How do we basically prove, quote unquote, prove that the care cooperative really model really works in practice in the global south. So we have this slide to explain the structured approach to promoting care cooperatives. We have a global, it's important for me to say that we have a global a program which is centered around the provision of care through cooperatives, and which is a collaboration between our Co-op SSC unit in the ILO and the Gender Equality, Diversity, and Inclusion branch of the ILO. And we work hand in hand to put together this global program, and we're implementing it in a set of countries. So we usually start with a national assessment to basically explore basically the viability in a certain country of care cooperative models. So we look at the policy level. So we look at cooperative laws, if they basically if they're first of all aligned with our ILO recommendation 193 to basically see if they are close or closer to the international cooperative principles and values. And then if that law basically allows the establishment of cooperatives in the care economy. We look at the institutional setting. So do we have support organizations for care workers on one side, and then for cooperatives on the other sides? We look at the financial mechanisms, if there are any appropriate financial channels or financial parties basically who fund cooperatives and care cooperatives. or not. So we really look at the macro, the meso, and the micro level to see if we can pilot a care cooperative initiative in the country. When I say care, of course, I mean we look at the priorities at the care, basically strategies, if there are any national care strategies, to see if we go into childcare, elderly care, domestic work, or other subsectors of care. And then once we've done this assessment, we go through a tripartite validation. Basically, this means that we validate those findings with our governments and the social partners, so employers and workers organizations. And we try to identify, this is also about identify partner organizations, so care workers organization, Apex co-op organizations, that will help us implement, basically, through which we can implement the care cooperative model. And then we usually go into a kind of a feasibility study. So this is more practical. Once we've studied kind of the enabling environment or the ecosystem around cooperative care cooperatives, we try to see if in practice it works. So we identify a certain region, we look at certain types of care workers, and then see if it's feasible. We look at local partners, municipalities, and so on, who can basically push the model on the ground and look at the costs and the viability of that model and the technical capacities and the skills of care workers and so on. That is part of a comprehensive feasibility study. And then we go into capacity building, and I will talk about that in a bit. We have tools called Think Care Co-op and Start Care Co-op, basically, which train care workers on the establishment of a care cooperative. So this is a very hands-on, practical tool that allows care workers to come together and establish and register a cooperative. And then we implement that multi-stakeholder plan to implement the model. So in parallel with the capacity building, we look at if the trade unions want to be part of that model. Sometimes they are the ones initiating these initiatives. We look at local government. If for childcare, for example, they want to provide a facility for a childcare center. We look at financial actors and so on. So it's really a multi-stakeholder plan, which is sort of, essential for the success of that model. And then once we have, once the care co-op starts running and we start seeing results, it's important for us as ILO to collect information and results and try to see how we can, what works, what doesn't work, how we can replicate and scale up, and how countries can learn from each other. So this is the tools, the capacity building tools that I talked about. So we have Think Care Co-op, which is a one-day basically orientation tool that helps care workers understand what cooperatives are, what the principles and values are, and basically if this is a model that works for care workers. In a tool like this, we don't really impose a model. We show the different mechanisms of establishing an enterprise. Could be a traditional enterprise, could be an association, could be a cooperative, and then the workers are the ones who decide on the most suitable model for them to provide care solution based on their needs and their challenges. And then once they are convinced in a way, we go into a more operational type of training, which is Start Care Co-op, which is a 5-day training which guides participants through the process of starting a care cooperative. So really developing a business idea, putting together a business plan, putting together the finances of that new entity, and going into formal registration if the legal framework, the national legal framework, allows. So this is This is the approach that we have in the ILO: assessment, validation, capacity building, involving multi-stakeholder into the approach, and then documenting. So we've been working in a number of countries. I picked two examples just to give you a quick idea of some preliminary results. Our work started in 2023, so we were starting to have results in Colombia. So in Colombia, going through that process of, from assessment to good practices, lessons learned, documentation, and so on. There were two basically organizations that were supported by the ILO. So the Hosa Women Peace Builders Organization, which is a network of 250 indigenous women weavers focusing on developing community-based childcare services in their region. So we've helped them basically come together. We've worked on improving the governance of their network, putting together the childcare services. We've put in some seed funding for them to renovate a community care center for children. And this is, I would say, an easier case because we're not starting from scratch. These women were already working together, and we've helped them come together in a more formal way, and we've worked on the governance and the business model to be able to provide childcare services for their members. And then the Midwives Association is another organization that was selected. Basically, we've supported them to establish a dedicated midwifery space for 250 women, and they are exploring the creation of midwives union. This is, of course, a long process of assessing and capacity building and advocacy, which led to those basically two organizations. And I wanted to highlight in Colombia basically the multi-stakeholder approach. So colleagues, I mean, I am not the one directly involved in this, and neither are we as a team in headquarters. These are our colleagues based in Colombia and supported by the regional office for the Americas in Lima, in Peru. They've done a really good job in involving multiple stakeholders. So the national government, you can read on the slide, the National Women's Fund program that is promoted by the Ministry of Equity and Equality, SENA, the National Learning Service, the Colombian Institute for Family Welfare. And then local key stakeholders are the indigenous authorities, the local municipalities, the private sector, and so on, and other partnerships with the trade unions, the international cooperation, and the Working Group on the Care Economy and Feminist Economy Coalition, each of them having different roles, of course, but participating in the success basically of these two care associations slash cooperatives. Um, I have another example also in Palestine. Actually, this is a model that was initiated by the Palestinian General Federation of Trade Union. Basically, they are the one who pushed into the formation of a childcare cooperative in Nablus in the West Bank. And after going through the assessments and so on, and the identification of care workers and so on, there was a cooperative that was formed. These are a little bit the steps that we've been working on. They've been working on getting a nursery licensing. And then they've done awareness campaigns, and we've done capacity building. And basically now there is the first basically childcare cooperative childcare center led by a cooperative, coordinated by the Federation of Trade Union in Palestine. And I would say in the Arab world, I think it's the first model that we have in the Arab world, and we're trying to promote that model in the Arab countries. It is very difficult now in Palestine, given the context and the restrictions and the limited financial resources and the rehabilitation of facilities needs and so on. But it is a model that started working. And again, the multi-stakeholder approach in Palestine is that there is a diverse membership. So basically, working women and families from sectors like electricity, the Nablus governorate, municipality, and agricultural and food processing unions. So the co-op includes employees from the electricity company, yeah, the municipality and the food industry. And then, as I said, PGFTU, the Palestinian General Federation of Trade Union, is the one leading that, and they are the one who provided a childcare facility for free, while we as ILO provided support, startup costs, technical assistance, and capacity building. So I have two more slides. Luca, if you don't hesitate to interrupt me, I'm not keeping track of the time.
If you can quickly
Wrap up.
summarize as
Okay,
well.
I will. Thanks.
Thank you.
So this is just some indicators on basically the enabling factors for successful care cooperative models. So the stakeholders that we think should be involved are, of course, the co-op SSC movement at primary level, at federation, secondary level, to provide technical support, to increase collaboration between cooperatives. The care sector providers basically that needs awareness and training on the cooperative model, but also the cooperatives who also need some awareness on care as a sector and as a skill. The involvement of government and local governments for supportive legislation, access to funding and resources, national social protection schemes, and then international organizations as ourselves and other to provide basically the support, the partnerships, the knowledge, and to promote good practices and share global lessons. So in conclusion, SSC entities, as I said, are essential for the provision of care and inclusive for the provision of solutions to the global care crisis. They are locally driven and people-centered models that are gender responsive, equitable, and sustainable, especially where gaps in public and private systems exist. So what we learned from the Colombia and the Palestine experiences is that care solutions definitely must be co-created with communities. There should be involvement of government and multi-stakeholder coordination. And SSC models have the capacity to formalize care work, protect rights, and redistribute unpaid care responsibilities. I will stop here. I hope this was useful, and I'm ready to answer any questions you may have. Thank you.
Thank you very much. Thank you very much. Are there any questions from the participants? Yes, Anne from Eva KU Leuven. I'm reading the question. Perhaps one question about the tripartite validation. What's the primary purpose of this validation? Is it part of the enabling factors? And is the tripartite validation generally a smooth process that can foster the development of COPs, or are there any challenges linked, for instance, to national differences in terms of SSC recognition by national government or different perspectives from trade unions and employer organization on COPs as a business model?
Okay. Thank you, Anne. Do I answer now, or you want me to?
Yes, please.
Yeah, okay.
Yes, please.
So Anne, just to answer you, this is business as usual for ILO. Everything we do is basically based on tripartite consultations, and we already know the partners that we work with at the government level and also the social partners, employers and workers organizations. So per se, it's a smooth process, and the tripartite constituents are involved from the beginning in the assessment phase, so they already know what we're doing, and it is basically also demand driven. So we get requests basically from governments to work on care cooperatives or to help them update their co-op law and try to see if we can basically help them basically improve the law so that it allows the establishment of care cooperative. So it's a validation process also to basically present the results and say, okay, this is what we've done. These are the results. Do you agree? Do you not agree? So that we can create ownership, but so that we also try to look at the future. So once we've, validated the results, we say, okay, this is what we can do. These are the partners we can work with. So it's an ownership kind of exercise, an ownership confirmation of ownership, but also putting the next steps into place and getting recognition and buy-in from the stakeholders on that. I'm just trying to, because there were many questions in that question. Yeah, I mean, the challenges to national differences in terms of SSC recognition, of course, I mean, I just talked about cooperatives, and that's straightforward. Usually countries have in place clear co-op strategies or co-op laws, but if we're talking SSC, then we're going into different categories, and a lot of the countries don't have frameworks for the SSC or national laws or national strategies. It becomes a little bit trickier, a little bit difficult. But I would say that, at least from my perspective, we try to have a practical approach. The point is, for that assessment, of course, we look at the policy level and so on, but at the end of the day, we want a model that works for the care workers, that basically allows for increased women labor force participation. And so whether we go into a co-op model or an association model or any type of SSC, if it is recognized and if it is formal, it allows the transition of workers from informality to formality, then we go with it. And then it's always based on what the care workers know and need. It is not something that we impose, and we try to have it aligned, of course, with the national legal frameworks.
Thank you very much. I don't know if Anne or others have other questions. Okay. Yeah, by the way, Ryan, you mentioned Colombia. If I'm not wrong, there are some news, recent news in the legal framework at national level in
Yeah,
Colombia.
that's true. On SSC, correct.
Yeah. So it's a new or a renewed framework, if I
Yeah,
understand well. Yeah.
correct.
They call it popular and social economy, right?
Yes, exactly. Yeah, that's a term it's a common term in Latin America, popular economy.
Yeah. I see an hand raised. Mr. or Charlie, you have to write your question in the chat box, please. If you want to do it now, otherwise you can take your time and then we can have a final answer. Okay. Well, anyone else who has question during the presentations can also ask a question in the chat for a previous speaker, and we will get back to him or her. Oh yeah.
Sure, I can, thanks, Charlie. I can share that. I can share a few links in the chat so that you have most of our documents are accessible online.
Thank you very much. For just and there's a lot of materials, and let me remind that maybe not all our participants are aware of the fact that the United Nations and ILO are driving since years a United Nations task force for social and solidarity economy that is gathering together members from United Nations agencies, OECD, European Commission, and others as a partner. And there are also a number of observers from social and solidarity economy practitioners or research networks and so on. And two of these observers are also part of the DICES project. So for the moment, thank you very much, Ryan. And now we go from the global world, from the whole world, from a supranational perspective to a continental one. Dr. Rose Karimi, welcome. As I said, Regional Director of International Cooperative Alliance, Africa. Rose, if you can put your presentation there, thank you very much. The floor is yours.
Thank you. Thank you very much. Good morning, good afternoon, and good evening from wherever you are joining us from. I want to talk about something actually that's often overlooked, especially in Africa, and yet it's at the center of our economies, our communities, and even our cooperatives. This is the care sector. And more importantly, I will share about how cooperatives can help us rethink and also restructure this in Africa. Now, before I move far, I want to share a personal experience. I believe we all have experiences, and I would like to start from a personal experience because, as many of us, care is something that we have experienced long before we even understood it. When I was growing up, my mother was part of a women's group. She still is. And what I remember is that the women would meet regularly. She happened to be the chair of that group. They would meet regularly, at least every week, under our mango tree, discussing their strategies, their savings, and other activities. And at time, I remember they had a tree nursery. I mean, where they were germinating trees, indigenous trees to plant in public spaces. Now, when the women came, what was striking it as, like half of them would come with their children, little babies, strapped on their backs. And much as we were children, we were assigned roles, and the role was to babysit. So we became the caregivers. We would carry the babies. When they cry, we would soothe them, play with them, so that the women could participate fully in their meeting. At that time, it felt normal. But looking back today, I realize that was care work. It was unpaid. It was not recognized. Yet, it was absolutely essential, at least to allow those women participate. Now, this experience, which I'm remembering, is not unique. This reflects what is happening across Africa every day. Care is happening everywhere, in homes, in communities, even within the cooperative spaces. Yet, it remains very invisible. Now, this is how I'll do my presentation. I'll try to define what care economy is, I said I participated in it, but then I didn't even know that that was care work. What's the importance of the care sector? And at least we've been given the importance from the ILO's perspective. And in this presentation, I'll use a lot of ILO's data and statistics because they happen to be the people that are most engaged in the care sector. Then I'll look at Africa's care gap. And in that care gap, I'll try to give examples of the paid care workforce that we have currently. Then, do we have care cooperatives in Africa? Yes and no. Yes, because we have emerging care cooperatives in Africa, and no, because a lot more needs to be happening. We also talk about the savings and credit cooperatives that are engaging in the care economy, not as a separate kind of work, but just exercising their principle number 7 of the cooperatives, which is concern for community. And then from the policy perspective, I will look at ILO's 5R framework. And then I'll conclude with the way forward. So what is the care economy? According to the ILO, care work encompasses all activities and relations involved in meeting the physical, psychological and emotional needs of adults and children, old and young, including child care, elder care, and care of the sick, persons with disabilities, and domestic work. Now, much of this unpaid work, care work is what is happening currently. Child care within the family, we've been told that in Africa, the foundations or the traditional way of doing things, most child care is taken within the family, either the nuclear or the extended. We also care for the elderly or the relatives that are not well, that are sick. There's the cooking, cleaning, fetching water, and fuel, which unfortunately is work that the society norms or the social norms attribute that to women. And then there's a community-based voluntary care and other performed works that are done predominantly by women. For the paid care work, we have those in formal employment, in health, in education, and social services. We have domestic workers like cleaners, nannies, and home carers, community health workers, early childhood practitioners, and even home-based care for elderly and the sick. Now, what's the importance of care work? I think we've been given some statistics, and I'll just reinforce on the same. We have 299 million decent jobs that could be created globally by 2035 if we invested in universal child care alone and long-term care. That's according to ILO. 269 million additional jobs by 2030 under the ILO High Road Care Investment Scenario, which could reach 475 million total care jobs. Now, in terms of investment needed to realize that, or the care economy's potential, we are talking of 18.4 trillion US dollars. That's 18.3% of projected global GDP. Those numbers are just big. And another importance of our care economy is the fact that investing in care is simultaneously advancing different SDGs, like SDG number 3 on health, number 4, which is on education, and even the gender equality, now that we've seen greater than 75% of the unpaid care work is done by women. And of course, above all, the decent work. Now, we are saying the burden is not equally shared because women are carrying a majority of the work, just like the women in my mother's women group, balancing the economic activity with caregiving responsibilities. This has got real consequences. And what are the consequences? It limits their ability to participate in formal employment, their ability to make income, even productivity. If someone wakes up before dawn, has to go to the stream or to the river to fetch water with a child strapped on their back, then you can see like by the time they come home, then even their productivity decreases. And also leadership, participation. Even becoming a leader in the cooperative becomes a daunting task because you have so much care work that you're carrying out that may not allow you to become a leader or even to have the time for leadership, even participating in the cooperatives themselves. Now, when you look at the data again, if we focus on Africa, we are saying 3.5 times, 3.4 times, or women spend 3.4 times more time on unpaid care than the men. In North Africa, again, using data from ILO, North Africa has the world's highest rate of women outside the labor force. And what are their reasons? They cite care as the reason. And this is our 63%, which is far above the global average and every other world region. Because they're involved in care, then they're not able to work in the formal sector. In sub-Saharan Africa, again, 68% of community health workers are women, mostly young, 59% of them with only primary education, and they only receive non-monetary incentives. While the rest are unpaid. Now, in Mali, women in Mali will spend around 24.7 hours per week on unpaid care. Of course, compared to the men who only spend 6.6 hours. And if you monetize that, then this work is going to equal approximately 17.6% of that country's GDP. Yet again, I say this is invisible work. Even when you go to their national accounts, it's not accounted for. In terms of social protection, only 18% of the African population receive at least one social protection benefit. Most care workers, as we've been told, are in the informal economy. And if you're in the informal sector, then you fall outside all social protection floors. So who does paid care work in Africa? The paid care workforce is large in Africa again, and this is largely informal. It's covering health, education, social services, domestic work, and community work. And I say, as while it's essential, it's marked by persistent decent work deficits, as documented by ILO, where 65% of global paid care workers are women. In South Africa alone, we have over 800,000 domestic workers. These domestic workers, much as they in paid care work, they experience long hours. There is even reports of violence and harassment, which is common, not to mention the low pay. And because they're in the informal economy, majority of them, they lack the needed social protection. So again, when you look at decent work, the low wages, no social protection, violence and harassment, long hours and low representation, it tells you that these are decent work deficits. This is not how it's supposed to be. But unfortunately, it's happening. So, can cooperatives give us a way forward? Yes, they can. Why can they do this? because much as we've seen the care systems in Africa are informal, they are underfunded and fragmented. They can still be structured through cooperatives. The workforce in the care economy can be organized, and there can be sustainable financing. And if this is done, then care will become visible as opposed to the invisible and undervalued care work that is happening now. So the issue is not whether care exists, because it exists everywhere. The issue is, do we have the systems? The answer is no. In a majority of our African countries, we do not have the systems to formalize, to structure, or even to organize the workforce and finance the care economy. We've been told that a strength in Africa is the strong traditions of solidarity and collective action. And I confirm the same. Much as we do not have widespread care cooperatives, we have something important, which is the foundation. We have community systems. I talked of my mother's women group. A lot of women in Africa are organized in groups. And there's also an informal network of care that exists. Now, cooperatives will allow us to structure this, provide fair compensation, deliver affordable services, and build sustainable systems. When we look at the continent, I came across some examples of some care cooperatives. In South Africa, we have domestic workers that are organized into a platform cooperative called We Care. Now, it's a digital platform which resulted as a result of a research done by the University of Western Cape and domestic worker trade unions with 47 founding members. They co-own and democratically own that platform. Now, this addresses ILO's reward and represent pillars because it has shifted the ownership of the digital infrastructure to the workers themselves. Through their phones, they can connect to places where they can work, and the employers or people seeking domestic workers can connect and get a link with them. In the same South Africa, we also have a domestic worker cooperative platform which aims to build a replicable decent work cooperative model for domestic workers in the platform economy. And this is also grounded in the ILO principle that cooperatives can shift marginalized workers from vulnerable to decent work. In Rwanda, we have something interesting where we have a national community-based mutual health insurance scheme, and resources are pulled together democratically from households, government and employers at community level, and they cover families, especially women who are in the care role outside formal employment. This is community-owned and governed, governed as a cooperative structure. And then finally, we have an APEX, or something that was launched in Cape Town by domestic workers from 17 African countries, which is the African Domestic Workers Network. This one advocates for legal recognition, collective bargaining rights, and ratification of the ILO Convention on Domestic Workers 189. It operates as a federated membership organization and the closest Pan-African cooperative structure for care workers. It has over 95,000 member workers. So opportunities exist for the care economy to be structured, especially on the continent. I said we have some cooperatives that exist as cooperatives in other sectors, like in the finance, the SACCOs, that try to do or try to operate in the care economy, but mostly, for most of them, in Africa, they'll do it as an ad hoc. It's not like a consistent way of doing things where they just practice their CSR or their principle number 7, concern for community. However, we have some like this collaborative circle that was established by Udhabiti Africa. It's a foundation, which is a dedicated circle, savings and credit cooperative for child care workers in Kenya. It provides savings, credit, and financial inclusion, especially for a workforce that earns poverty wages and has no formal social protection. This collaborative circle is part of a broader platform that includes 11,000 member network for women in childcare. In Uganda, we have Warrior Circle. This one was supported by ILO's COP Africa, and it extended its CSR mandate to reach women living with HIV and AIDS and victims of exploitation, providing alternative livelihoods and care mitigation services. Membership has grown from 500 to 648, with a turnover of 3,465 USD, which has grown to 16,690. It has
Rose,
created.
excuse me, sorry to interrupt. We are a
Yes.
bit, let's say, closer to the next speaker's time. Can you please
Let me
a couple of minutes? So thank you very much.
finalize. Thank you.
Thank
Thank
you.
you for letting me know that. On the policy recommendation, I would recommend that governments at least follow the 5R framework provided by ILO for the care economy. That's recognize, reduce, redistribute, reward, and represent. So there's more in that. Only a few governments have ended to that, like in the recognizing, I think in Mali, the unpaid care work is being made visible. And other examples of redistributing, all those are policy recommendations that governments can carry from ILO's 5R framework. Now, what's the way forward? I think for policy and government, integrate the 5R framework into the national care policies, ratify the Convention 189 for ILO, invest in public child care and elder care, extend social protection to informal care workers, and conduct national time use surveys to make unpaid care work visible. For cooperative and circles, I think this is an opportunity. Why is it an opportunity? They can formalize their care CSR activities through dedicated welfare and care funds, and I'm happy that ILO has got a structured way of creating or establishing care cooperatives that they can learn from. They can also establish sector-specific circles for care workers, scale WeCare, like the WeCare platform, federate care cooperatives through the national apex, and link circle financial inclusion to the ILO convention. For worker organization, organize the domestic workers into cooperatives and unions, build on the platforms already existing or start new ones, demand representation, use their structures to fund collective care emergencies, and connect African care cooperatives across national borders. I think with that, I will just quote that a well-functioning care economy not only supports individuals and families, but it also contributes to a healthier workforce, creates jobs, and enhances productivity. That's according to ILO Resolution on Decent Work and the Care Economy, June 2024. For Africa, investing in care is not a welfare expenditure. It's an economic imperative and a path to gender justice. Thank you.
Thank you very much, Rose. Thank you very much. Your presentation, like all the three presentations, are available for those who want to then ask and so on. Oh, thank you very much for also this statistic link that has been added to the chat. We have a question. Celestine asks, in your first example on babysitting, could it be considered as a job according to African culture? Isn't it a work and not a job? Let make ILO take into consideration the difference between work and job. I don't know exactly what is the difference between work and job. But can you?
That's for ILO for me.
Sorry, Luca, is this a question for me?
No, I think the question is for
Rose?
Rose. Yes.
Oh,
I,
I don't know personally because when we were being assigned those roles, we were children, we were small. And so I think it was not considered work then. I think it was just considered like a normal chore that you're supposed to take care of these women's children when they came, feed them, and it wasn't work. We were very young in primary school. Thank you. I don't know whether I've answered that.
yeah. Thank you. Thank you very much. Yeah, I think it was referring to your opening about how we all experience care work in a way or another. Time is running. I would quickly go. Thank you very much, Rose, again. Anyway, all materials are available, and now we narrow a bit. We go, as I said before, to the ground because DICES project is not only focusing about care, it's focusing on organizational democracy and is also analyzing how the business model, the social economy business model, can provide a way to have to democracy, to democracy, working condition, etc. And dealing with Africa, but not only, we met the relais model, and we thought that it was really interesting to share this with you because of the tremendous impact and the tremendous work that Pauline Effa is doing. Pauline, the floor is yours. Pauline, sorry, you are muted. Yes.
Is it okay now?
Yeah.
Yes.
Paulina, we'll share your presentation, and when you want to move to the next slide, you just tell me next slide. So we move forward like this. I will do it in a second. I mute myself again. So you're
okay. I will. It will not be very long because of the language. If you allowed me to make it in French, it will be more easy for me. But I will try. So I'm going to talk about the relais model. My elder presentators talked about care and care system, but we think that talking about social and solidarity economy in Africa means first organize the system or organize the area. So The Relais model is the local network of social and solidarity economy. So it is a systemic structuring undertaken by our NGO since 2008, and we are moving forward. Next, please. Davide, could we move? Okay. The reason for structuring actors of social and solidarity economy is to make the anchorage of the social and solidarity economy in the local area, in localities. So the first model of enterprise we chose was the cooperatives, because we thought that in Cameroon or like in other African countries, we need to rebuild the system of co-op which collapsed in some years before. So we want to rebuild it through a truly dynamic cooperative movement by creating inclusive dynamics to drive harmonious local development. We need to do that, because if we just say social and solidarity economy, for us here, it means everything, and it can go here and there and not having impact at all. Next. So the concept is bringing actors in one areas, bringing them inside what they are doing, and make them move into cooperatives or create cooperative. So the Relais is as a prominent private local organization. It is backed by local actors. Then we can build a bottom-up approach, starting with what we are doing and moving toward our government, because we don't really have support of the government. So we had a law, but our activities are only made by our own voluntary. So we build local enterprises, starting by cooperatives, but we think that in years towards, we are going to have all entities in social and solidarity economy inside the Relais. The first we chose was the cooperative societies. So we build local enterprises which can also join the Relais and participate as a member under the cooperative principle of one person, one vote. So just doing the partnership between private entities. Can you move forward, please? What is the Relais network about? It is a place to facilitate cohesion and inclusion. You think that if you have a Relais well constructed and dynamized, we can address the question of care system inside the Relais, because it is the place where we can support women and young people to create activities and to generate activities and jobs in one local area. So it could be a local cooperative network, perhaps. Now the Relais is an association, but it can move towards a local cooperative network because it is admitted by the law of cooperative society, a Pan-African law, supranational, which involves 18 countries in Africa. So the Relais provides a framework for dialogue between structured community and local officials. When we are structured inside the Relais, it is easy for us to move towards the local authorities and make partnership with them. So it can be a way to have the strength to make a dialogue with them. The Relais is also enable the mobilization of enhancing of indigenous potential. So when we build the Relais in one place, we bring actors to show all what they are doing and to build cooperatives or social enterprises in the sector where in which their activity belongs. So it allows for better support of local stakeholders. I've seen that. It's raised the profile of local socioeconomic potential. It generates activities and let me see, I can read. It raised the profile of local socio-economic potential and generate activity and employment within the territory. The project involves establishing a local economy and social network in each municipality. That is what our project. The project is to have 360 Relais in the 360 municipalities of Cameroon. It is not yet the case. Can we move?
Yeah.
So the Relais and the
Pauline, sorry, can I ask you a question?
Yes.
Thank you very much. But I don't feel any problem with your English, frankly speaking. I think it's
really.
Yeah. Thank you for your effort. But just to make it more clear, for those who don't know yet the Relais. So essentially, what Relais is correct me if I'm wrong, is a cooperative created at local level, let's say a municipality, where people and also enterprises are gathered together. And you've been doing this for many years.
Yes.
Why? Yeah, to support my understanding when we were in Cameroon, it was that this was helping, for instance, local producers and local farmers in order to have a common, let's say, policy or a common position, a common power on the market. And then it expanded also to help providing services like social services, care services, and potentially to develop new activities like sustainable tourism, like the experiences that we visit there, or collective energy, energy communities. Is this and you have 360 municipalities in Cameroon, right? But you already created how many?
298.
298, which is
Yes.
quite a good market share, like 80% or something, right? Okay.
Absolutely.
Okay.
Yes, thank you. Thank you for your help. So I think the next slide will, of course, speak about the cooperatives putting their strength together and try to ease the market, try to reach the market. So once structure within local solidarity economy network, the avenue for creating decent job for young people, decent job and sustainable activities are enormous. In supporting stakeholders, these needs are estimated over 50 young people in every locality to support those enterprises, because the mamas on our villages don't exactly know about entrepreneurship. So we train young people to make them put themselves together and continue by training them so that they can become their clients for the future, because they will always need trainings. So that is why we are training more and more young women now, more and more young people now, through the local cooperative of service. So we make them put themselves. I will zoom on the cooperative of service, because in the cooperative of service you have many young people who offer services in the community and in cooperatives too. So they ensure logistical needs during the organization of cooperative markets, for example, in the localities. So they can they can collect goods, they can transport goods, handling, storage, marketing. Those are all actions in which we can professionalize young people in local area through services to local stakeholders who are members of the cooperatives. They offer opportunities for multi-sectoral professional development, agricultural practices, for land clearing to harvesting, health and services, etc. Next slide, please. So the cooperative of services, it is a tool for local revitalization, attracting and retaining young people in the localities. This momentum requires ongoing support. These activities keep young people engaged in the community. So they keep them in the localities so that they will not move towards town and perhaps towards Europe, for example. The proliferation of activities and jobs through cooperatives allows for massive youth involvement and the revitalization of social and solidarity economy. This dynamism also makes these communities more attractive and encourage the return of those who left due to a lack of vitality. So they can often organize the cooperative markets to permit the actors of the localities to reach the market so that they don't need to transport their goods to our town and not sell them in the better price. Next, please. So to settle the relays, we have a method. We start by awareness raising, training at various levels, structuring, ongoing support, continuous lobbying, ongoing monitoring and evaluation, and we need to equip them to do all this. Next. Yes, as we said, the objective is to reach 360 relays, one in each municipality. We have 298 relays established. We have already trained 364 young people trained in community awareness and structuring. Since the first edition of 4IS conference here in Yaoundé in 2024, around 20 African countries are fond of the relays model. That is all. Thank you.
It is not all. It is the start. Merci beaucoup. Thank you very much. Okay, congratulations.
Speak French.
Okay.
Thank you for all.
Ok, on va faire une autre fois en français, ok? We are going for another time in French. Thank you very much, Pauline. Listen, we are a bit beyond time. If there are dedicated questions, but we all know that this is not all. Absolutely, it is really an important model for Africa. I must say that there is also an agreement with the ICA to promote again and to implement, and we are working on it because it's really important. And I think it can be also useful from the European side to be aware that how much powerful is to build the community building part of this model. That is, and we are really we have to learn. But among the things that you listed, in my opinion, there was one missing. It is a leader. That what is needed to create relays is a leader like you in Cameroon and in Africa, and this is very important. It's also a matter of leadership, of being credible and giving the example. But anyway, almost 300 municipalities out of 360 is really amazing as an impact, and we look forward to meeting you soon to have updates on it. Thank you all for this. I don't know if there is any better way to conclude this first webinar on the Global South. We will see with the DICES coordinators and colleagues how to prepare the others, and if they think that another one on with Africa or other part of the global world can be interesting, and we will know soon for the next. For the moment, thank you very much, everyone, for investing your time in being with us. Continues following DICES on the channels on the LinkedIn, and see you soon. Bye. Thank you very much. Thank you.
Thank you.